Hello, welcome again to Miami Community Health. I'm Dr. Anthony Gonzalez, your host for another important health topic. April is Sarcoidosis Awareness Month. Sarcoidosis, that's a mouthful. What is sarcoidosis? What part of the body does it affect? How does it affect people? What is it? So obviously we're going to learn a little bit about sarcoidosis because I think it's a relatively rare condition, not very common. A lot of people don't know about it. And so I brought the appropriate doctor. I brought a pulmonologist, a lung doctor, a critical care doctor specialist, a colleague, a friend from Baptist Hospital, Fabriccio Letellier. Welcome, Fabriccio.
Well, thank you for having me here. It's a pleasure. And let's talk about sarcoidosis.
Yeah. Well, before we talk about sarcoidosis, let's talk about a pulmonologist. So obviously sarcoidosis affects the lungs. So that's why I brought a pulmonologist. So what does a pulmonologist do? What is your line of work?
A pulmonologist is a subspecialty of internal medicine. And what we do is just see people with lung disease, basically, in the hospital and in outpatient.
And so lung diseases, you take care of anything from lung cancer to what people like emphysema and people that have breathing problems. What are some of the common things you take care of?
Common things are asthma, emphysema,
I forgot about asthma.
COPD, also lung nodules, lung cancer. There are rare diseases that, pulmonary hemorrhage, pulmonary fibrosis. We also see a fair amount of sleep apnea patients.
Oh, that's true.
For whatever reasons linked to pulmonary. And then most of us do also critical care, mainly in the hospital.
Okay. So let's get into sarcoidosis. What is sarcoidosis?
Sarcoidosis is a chronic inflammatory disease. It's basically a lump of immune cells. They get together and create inflammation. It becomes chronic and it can damage organs like common lungs, skin, eyes, kidneys, liver.
And does it focus more in the lung? Is that why you're more involved in it?
It's very frequent in the lungs, but
Okay.
it's also, like I said, frequent in the skin, which is, as we know, is the major organ in the body, eyes. So, but basically it's very common in the lungs.
And so you talked about inflammatory cells, inflammatory cells that are getting together. Do we know the cause, or are these one of these things that we don't know why this happens?
Years ago, we kind of didn't know the cause. Nowadays, we know it's a chronic inflammation. It's an overimmune reaction of our immune system, and that's related to it could be to environmental factor, to an infection. It could be we don't know, or it could be, even though it's not hereditary, so we're not going to get it from our parents, or there's some genetic links to it. There's been some genes linked to sarcoidosis, and because of that, you can see it in several family members, even though it's not hereditary.
Oh, wow.
Yeah.
Okay, so one of the things we can't do, and I was going to ask you, is there a way to prevent from getting sarcoidosis? You obviously can't get away from your own family, and you can't get away from the genetic portion, but you talked about it's so variable. It could be environmental, and it could be immune. Is there a way to prevent from getting sarcoidosis?
There's no way to prevent them because a lot of people get sarcoidosis and they don't know it because it could be a self-limited disease. So if they have it, they get sick for a few weeks and then it goes away and they never realize it. Another percentage of people, they develop chronic changes on whatever organ is affected. So there's no way to prevent it, but it's good that we're doing this so we can make people aware that this is a disease that is out there. There's actually fairly frequent in the United States. I think there's about over 200,000 people affected.
Wow.
in the United States. So it's very common, and there's treatment out there. The prognosis, for the most part, is good if you catch it early, especially.
Okay, so somebody's listening out there, and what are the symptoms that people should be concerned about to not only for sarcoidosis, but really, any pulmonary condition? So what are these symptoms of sarcoidosis that people should be worried about that, hey, I need to go see my primary doctor. I maybe need to make an appointment with Dr. Letellier, a pulmonologist.
Okay. The first thing is that most of the people with sarcoidosis are young, fairly young, in the 20s and 40s. That's usually when they develop disease.
Oh, okay.
So if you're 80 and have the same symptoms, it's most likely not sarcoidosis. But the common symptoms are fatigue, tired, fever. They can have joint pains, muscle pain. So those are the common symptoms. Now, if you move to the organ affected, let's say affects your lungs, then you can get a cough, shortness of breath. If you get to the eyes, then you can get blurry vision, light sensitivity. If we get to the skin, then people get rashes and bumps on the skin. If we get to the liver, like I've seen patients with liver disease from sarcoidosis, the liver function tests get elevated. So,
so really fatigue, fever, and then shortness of breath, or obviously any rashes and so forth.
Joint pains is very common, especially at the beginning.
Pains.
Joint pains is very common, especially at the beginning.
All right, but we want to alert everybody: just because you have joint pains in the morning because you're getting old is not sarcoidosis, right?
Exactly.
There's more than that. Okay, so somebody is suspected, or maybe the primary doctor is suspected they have sarcoidosis, and they come and see you. What is the testing? What are you doing for the patient to try to make that diagnosis of sarcoidosis?
Yeah, the most common test that we do is a chest X-ray.
Okay.
A chest X-ray, most of us do chest X-rays in the office. A lot of patients come already with a chest X-ray, and then we'll usually follow that with a chest CT. And then from there, we plan, in our case, pulmonologists will plan to do something called a bronchoscopy of some sort of biopsy to get the diagnosis.
And so how do you get the diagnosis? Talk to us about a bronchoscopy for our viewers. They may not know what a bronchoscopy is. And how do you get that diagnosis?
A bronchoscopy is basically we take it's a tube, it's a light tube, a fiber optics, kind of similar science as a colonoscopy and endoscopy, but a lot thinner. And we go in through the nose usually or through the mouth and get into the windpipe. We get into the windpipe inside the lungs, and we can do biopsies inside the windpipe if we see abnormality, or more distal into the lungs, something called transbronchial biopsy. Or nowadays, in the last few years, there's something called EBUS, which is biopsy of the lymph nodes through ultrasound, through the trachea, or
through the mouth, through the mouth, and through the lungs.
Exactly.
Okay, so you do the biopsy, we send it to pathology, and the diagnosis is made with the biopsy. You have to have a biopsy pathology to make that diagnosis?
Yes, the diagnosis is based with pathology. Very easy when they see on a pathology, so it's no question about it. Also, if the patient you think has skin sarcoidosis or lesions in the skin, you don't really need to do a lung. You can actually get a simple skin biopsy and prove that with the findings of the skin biopsy and the lungs, the patient has sarcoidosis.
Is that because you're going to see something on the CAT scan or the chest X-ray that's sarcoidosis? Does it have a particular pattern?
Yes, on the CAT scan, radiographic patterns. There's 5 radiographic patterns, and it goes from normal X-ray to something called pulmonary fibrosis, which is kind of end-stage lung disease from sarcoidosis. But yes, the most common thing is hilar, what we call hilar lymphadenopathy. Basically, the lymph nodes in the middle of the chest, they're inflamed, and then when you see that, the key difference you have to make is because some people with lymphoma can get signs like fever, fatigue, tired. You want to make sure that it's sarcoidosis and not lymphoma, or lymphoma and not sarcoidosis, obviously different treatment and different prognosis.
Okay, so let's talk about the stages. So somebody goes to you, they see Dr. Letellier, you did the bronchoscopy, you did the biopsy, they have sarcoidosis. Are there different stages of this condition of sarcoidosis?
Yes, there are stages radiographically. There are not stages clinically. Radiographically, yes. 0 is a normal X-ray. Stage 1 is lymphadenopathy. Stage 2 is lymphadenopathy with pulmonary infiltrate. Stage 3 is pulmonary infiltrate, and then you get to stage 4 where you have pulmonary fibrosis, and that's obviously at that point is irreversible. And then we can talk about what we need to do about that.
So then, does the treatment depend on the stage, or what do you do? So what's the next path? Unfortunately, some patients have this. You're talking about how common it is. Somebody gets a diagnosis of sarcoidosis. How do you treat them? Let me ask you: do you not treat them? Are there patients that don't get any treatment?
Yes, there are patients that do not get any treatment. The stage of sarcoidosis, they do not correlate with symptoms. So you can have somebody with stage 3 and not a lot of symptoms. You can have somebody in stage 1 radiographically and a lot of symptoms. Okay. So usually you treat, but there are patients that have had that they have proven sarcoidosis and they're stable. You don't have to give them treatment, especially if they have underlying disease like diabetes, osteoporosis, when you know that prednisone, which is the main drug that we use in this case, can affect the underlying disease. So if the sarcoidosis is stable and you follow them every 3 to 6 months with normal or stable pulmonary function, you don't necessarily have to treat them.
Okay. And then the treatment, let's talk about the treatment. You talked about prednisone. Is that the only treatment? Steroids?
That's the cornerstone of sarcoidosis therapy for many years. They do really well with it. They respond amazingly. It does have a lot of side effects, but no, it's not the only one. Now we can do also methotrexate, which is an immunosuppressant. Now also we're using biologics, something called infliximab, and also some other biologic immunomodulators that are they're fancier, but we also can use those.
Okay. And then is there any other treatment besides medication? Do patients ever need surgery for sarcoidosis?
There is not necessarily, but pulmonary rehab, if they have in the line on pulmonary involvement like fibrosis or shortness of breath, you can do that. But yes, in the case of what I do, if you have end-stage sarcoidosis and pulmonary fibrosis, then the surgery, pulmonary lung transplant will be the next. You refer them to a lung transplant center, and they can do lung transplant perforation with sarcoidosis.
And will they necessarily get the sarcoidosis in the transplant? Well, in other words, will the transplant? So they get the lung transplant. Will the new lung have the?
Usually not, because if people get into immunosuppressant medication.
So the immunosuppressant itself is actually treating.
Exactly.
That's incredible.
You do the lung transplant because that's the only thing that's going to save their life, especially if they don't respond to therapy. There are some people with pulmonary fibrosis that, although you cannot reverse the pulmonary fibrosis, you can improve the inflammation caused by sarcoid, and they do improve. You only send those people to transplant that do not improve with a medical regimen.
All right. So overall, what percentage of patients with sarcoidosis are like people that are living their normal lives with no medication? Some of them need prednisone, and then obviously it's probably a small group that end up with fibrosis. I don't know. Talk to me about that. Like, what's overall prognosis? I got the diagnosis. I went to you. You gave me the diagnosis. Is this like terminal, I'm done, or no, likely you're going to be okay? Or
the prognosis is good. With therapy, the prognosis is good. People do live a normal life. The minority of patients end up with lung transplant.
Okay.
So it is something that you treat medically, and they do really well, and they go back to the community. The labs goes back to normal. The pulmonary function tests improve, and they just have to deal sometimes with the side effects of the medication. But you cut down the prednisone, cut down the immunosuppressant, and that's how you do it. But most of them, they do well.
And are they going to need to be on medication the rest of their life?
Not necessarily, because what you do is once you get them stable, asymptomatic, the lesion, especially if it's in the skin or if the lymph nodes have come down, then you start weaning the steroids. You can, or the whatever medication you put them on. In this case, prednisone. And then as you wean them down, if they don't flare up, then you don't have to. But if they do flare up, or they start having symptom joint pains or shortness of breath, or the lymph nodes swell up again, then you have to put them back on prednisone. But you try to do the lowest possible dose
to keep everything under control.
Exactly.
Now, are there things that cause the sarcoidosis to flare up or so forth? You have somebody you've treated for many years, and you've gotten them all the way down, maybe to a very low dose of steroids, or maybe no steroids at all. Are there triggers that cause that sarcoidosis to flare up and maybe come back?
The most common, mainly triggers of respiratory symptoms, usually viral syndrome, pneumonias, that can trigger a flare of the sarcoidosis. But like we touched, environment, if they're exposed to something environmental that will affect the lungs, yes, there are triggers that occur. Mainly, but they will get more respiratory symptoms. Not necessarily that the disease will get worse. They just get an inflammation on top of whatever inflammation they have with a viral syndrome, or if they're exposed to, for example, to bleach, the inhaled bleach or whatever they get. Yes.
Okay. And then is this contagious?
No. It's not contagious. You're not going to give it to anybody else. No.
Okay. And so we talked a little bit about prevention, because I'm always about health and prevention, and we always talk about ways to stay healthy. Is there a way to prevent this? Can I prevent this? We talked about already hereditary. You can't prevent what you already have in your genes and your family giving you, but is there a way to prevent sarcoidosis from getting it?
As far as we know, there's no way to prevent it. Only knowing that this disease exists. If you have a family member with sarcoidosis, it's something that you need to be aware that if you have symptoms similar to what we just talked about, then you have to be aware that this could be sarcoidosis, even though you don't get it from your family, but there's gene associated with it. So then you have to make your primary care aware that, listen, I'm having joint pains, I'm tired, my sister has, or my brother has sarcoidosis. So that's how you try to catch it early, because that's how they usually respond. And when you do catch them early, you avoid getting into pulmonary fibrosis, which most of the time takes a year to get.
Oh, good. And does it affect more a certain gender, female, male, or certain? You already told us 20 to 40 years of age. Does it a certain race, ethnicity?
In the United States, it's more common in African American for whatever reason, and it's actually more common in female. If you go to Europe, it's more common in Northern European. But yeah, in the United States, it's very common. Where I train in Virginia, very common. We saw sarcoidosis all day long.
Wow,
Yeah.
incredible. All right. And so sarcoidosis obviously is a condition we wanted to bring awareness to because obviously it's a relatively common, you talked about it, and it's something that's not a lot of people don't know about. Is it confused a lot of times with other conditions that maybe that bring shortness of breath or fever and so forth that people are sometimes you have to deal with? You talked about lymphoma that it can be confused with lymphoma as well.
It's a differential diagnosis with lymphoma, especially because the symptom at the beginning of lymphoma can be similar to a sarcoidosis, but it can also be confused with asthma. People treated for asthma for many years, never get an X-ray. Then one day they get an X-ray. Oh, my lymph nodes are inflamed, by the way. So usually, then you have to pursue that. So those are the most common things that are asthma, COPD. Sometimes if a patient smoke and say, "Oh, this is a COPD."
Right. So obviously, I think the key is to be alert to your symptoms, right? So if you have any shortness of breath, if you're having fevers, things like that, I think those are alarming signs. And right, I mean, if you're having fevers and shortness of breath for a short period of time, probably, I mean, is there a timeline that you tell patients, yeah, after 2 weeks, after 2 months of shortness of breath or fevers, you should be seeing a doctor or
If it's several weeks, I would say 10 to 14 days, and you're having fever, joint pains, you're tired, you're fatigued, you definitely need to be checked, not only for sarcoidosis, but for something else.
For everything.
So usually sarcoidosis, it's a very easy diagnosis to make. You can do it with an X-ray. And like I mentioned before, the key thing with sarcoidosis is make sure this is something like lymphoma, because like I said, the treatment is completely different. So you don't want to miss that. I've seen cases, and that's the importance of doing biopsy. I've seen cases, not very common, of both lymphoma and sarcoidosis on a biopsy.
Poor patient.
Not common, but that's the importance of doing a biopsy.
Wow. Okay. Well, obviously we have a pulmonologist, a lung specialist here, and I'm always about health and wellness and keeping your body healthy. Now, lung health, you made a comment already. Smoking, obviously a bad factor for sarcoidosis, which can irritate sarcoidosis. We were focusing on sarcoidosis, but let's talk about, just for the last few minutes of our conversation, and because we have an expert like you here, lung health. What are ways to keep our lungs healthy? What are the advice that you give our viewers? And, lungs are very important, man. We need our lungs, you learn about the importance of your lungs when you go underwater, right?
Exactly.
Right? That's the importance of your lungs. So obviously smoking is not good, but before we talk about what are the bad things for your lungs, how do you keep your lungs healthy?
Doing exercising. Exercising, I think, is a great thing, and you don't have to kill yourself exercising, but doing some sort of exercise, especially where you stress a little bit the cardiovascular system. So when you can do that, that's the best thing you do for your lungs. Avoiding substances that are toxic to the lungs, especially if you have genetic predisposition to this disease like lung cancer or COPD, then you need to avoid smoking. If you have condition like asthma, you need to make sure you take your medication, because you can prevent further damage down the line. And if you do this, you live a normal life. Inhalation. If you're in a business or you work where there's a lot of exposure to dust or toxic substance, you have to make sure you follow the recommendation of using masks. I say it all the time in the office where they work doing painting or doing something, or soldering, and they don't wear a mask, so they get lung injuries.
Wow, incredible. And then let's go to smoking. All smoking the same? Cigar, cigarette, vaping, talk to us about that.
It's not all the same, because for example, cigarettes more associated with lung cancer and maybe throat cancer. Cigars more common with throat cancer and esophageal cancer. Vaping, you can not as much associated with lung cancer, but it can be associated with inflammatory disease of the lung and hemorrhage, what we call hemorrhage, which is basically bleeding of the lungs, have been associated with vaping.
So I guess all types of smoking, no good.
No good. There's nothing good about smoking. I wish I could tell you something about it, but it's nothing good about smoking.
All right. Well, we have it from the expert.
Yeah.
Well, we've brought awareness to sarcoidosis. I think you've clarified it for me. Listen, I, as a surgeon, don't see sarcoidosis. I didn't know much about sarcoidosis. I even thought that there was maybe a bacterial predisposition or a basis, but obviously I've learned it's more of an inflammatory condition. And thank you for doing that. Thank you for taking care of our patients at Baptist Hospital and Baptist Health and bringing awareness to sarcoidosis. And good.
No problem. Thank you very much. It's been a pleasure.
All right. And obviously educating our viewers about healthy lungs. So what I've heard is to keep your lungs healthy is exercise. Exercise, stress your body a little bit is the best way to keep your lungs healthy. And all types of smoking is get rid of it. So thank you, Dr. Letellier, on behalf of Miami Community Health and Live Longer with Dr. Anthony Gonzalez. We want to thank Dr. Fabriccio Letellier to educating us with regard to sarcoidosis, because April is Sarcoidosis Awareness Month, and teaching us how to keep our lungs healthy. And on behalf of Dr. Letellier and myself, Dr. Anthony Gonzalez,